14-year-old patient from Uzbekistan with end-stage heart failure found a new lease on life at Artemis Hospitals after a successful mechanical heart, LVAD, implantation, turning a critical moment into a story of hope. Advanced heart failure treatment has significantly improved in recent years, allowing many patients to live longer and more active lives. However, it remains a serious condition that can progress and become life-threatening if not properly managed. That's why it's crucial to monitor worsening symptoms and consult your doctor to explore the best treatment options. One well-established option is a left ventricular assist device, LVAD.
End-stage heart failure is a very common heart condition in which the heart is too weak to pump blood to the body, right? It can happen because of a lot of reasons, but the end result of all these illnesses is that heart is weak, it is unable to pump blood to the body and its organs, and will have to be supported. Support can come in form of medications that will work for a while, but they will ultimately stop working because this is a progressive heart condition. Beyond that, either you have to change that heart with a heart transplant or support it mechanically from a mechanical heart pump, the LVAD devices.
Здравствуйте, меня зовут Хаитов Самеджон, я из Узбекистана. Моего сына зовут Дильшот, ему 15 лет. У него проблема была с сердцем.
A 14-year-old child from Uzbekistan, he has been suffering with cardiomyopathy, dilated cardiomyopathy for almost 10 years now. Over the past 2 years, his heart condition has progressed and he has been in and out of heart failure repeatedly and has had multiple hospital admissions for this in his home country.
Потом нам предлагали насчет Ишвара. Мы его контакт нашли, созвонились с ним. Он нас пригласил в Индию и нас привез в госпиталь Artemis. Познакомился с кардиологом доктором Асимом. И так получилось, что у моего сына было очень серьезное заболевание насчет сердца. И нам предлагали аппарат LVAD.
We have been treating this child for almost 2 months now. And the alarming thing was that even with the best medical management, he was needing ICU admissions multiple times, 4 times over 1 month. And to a point that his heart failure was so severe that his organs were starting to fail, the liver, the kidney, the function was deteriorating, and at one point it seemed that we will not be able to save this child. He was listed for a pediatric heart transplant in our center, but the waiting times are longer. Availability of organs is a difficulty, not just here, all over the world. And so after talking to the parents, we decided that we'll put in the newer mechanical support devices and in a hope that it'll help him survive.
У него было 9 часов или 10 часов приблизительно операция. На завтрашний день уже себе пришел, с ним поговорили, все было хорошо, удачно.
These are miniature pumps. The machine with time is getting smaller. With every version, it is getting smaller and smaller. So these devices, this pump will actually sit inside the chest. The inflow, it draws blood from the weak ventricle, the heart that is not pumping, it collects a lot of blood, and the mechanical pump will pull blood from the heart, and then through an outflow that is connected to the great artery, it will pump it to the body. And the only thing that exits the skin is a small drive line, a cable that will connect to the battery and a computer-based controller. Patients can carry it in a small backpack, on a belt bag. And this pump will last, the batteries will last for at least 17-18 hours. It is a magical device. It has the capacity to transform lives of patients and kids that have end-stage heart disease and they are limited to the bed. They are almost immediately after surgery, they are more mobile, they are more active. You can see the glow back on their faces. And in 2 to 3 days, this child was walking around, and it took us about 10 days, 12 days to discharge him. Now he comes for follow-up walking. He'll climb upstairs. He's smiling again, he's walking up. The smile on the faces of the parents is back again.
3 дня, где-то неделя лежал реанимации, потом в палату взяли, дай бог, слава богу, сейчас вот на ногах. Скоро выпишут нас, поедем в свою страну, дай бог.
Technology is advancing, medical technology, computer-based technology, it's advancing. And the kids these days, they're advancing with it. So this child is only 14 years old and he's managing his LVAD on his own with minimal support from the family and the parents. If everything goes as planned, we believe that he'll be ready to go back home to his country, Uzbekistan, in about a month's time. In about 2 to 3 months of time, I will expect that he will go back to school. And with a little bit of lifestyle modification, he's expected to lead a good life.